Hey, welcome to another video from SkinnyMedic, and I have an after-action medical report video for you. And this one, no trauma, no tourniquets, no chest seals, no wound packing, no March algorithm, nothing. This one still saves lives. 100% is going to save someone's life. ABCs, another one bites the dust, staying alive, 30 and 2. Sound familiar? This week's video is brought to you by Hero Coffee. Help everyone remain operational. Candace and I got this coffee and we like it. We drank it, you can see. We got the whole beans. We did get the dark roast. Candace and I both like dark roast, so that's what we got. And we have been drinking it. You can see, I'm actually gonna make a cup of coffee of this to edit this video here. So I have a problem. I know, I'm addicted to coffee. I get it. But most of you guys are too. So go over to drinkhero.com. I'll put a link down below and in the comment section for you. Go check them out. I think it's good coffee, honestly. So go check them out. Thank you guys for the support. This video is going to be more on the medical side. This is an autistic little girl from my backstory that I've gathered off Instagram who falls into a swimming pool and a bystander pulls her out and begins CPR. So let's take a look at it. Again, I will put a warning there. Alright, so first things here is let's get her out of the pool. We're not worried about back injuries, spinal cord injuries, neck injuries, things like that. You can't help her inside the pool. So pull her out, get her out of the pool, activate the 911. We used to talk about the old days, like carry the child, call 911, things like that, but most everybody has a cell phone now, so you don't really have to carry the child anywhere, things like that. So let's call 911, let's get help coming. That's a priority because you don't want to be doing this CPR by yourself for a long period of time. Most of the time when we're teaching lay people CPR, we teach hands-only CPR. Means you put their hands in the center of the chest, do chest compressions only at about 110 beats a minute, push about 2 inches down in depth, allow complete recoil. You don't have to so much worry about mouth-to-mouth anymore, which is awesome because no one wants to do mouth-to-mouth to a dead guy, dead woman. It's gross. So hands-only has played a huge effect into more people doing CPR prior to EMS arrival, I feel like. So that's awesome. However, there are some times where probably mouth-to-mouth or mouth-to-mask is important, and that's going to be where respiratory is involved, such as choking and drowning. So this guy here starts chest compressions, and yes, they are a little bit low. He's more like on the stomach, but I think bad CPR is better than no CPR, okay? I think he absolutely did a great job here, and I'll give him props for saving this girl's life. But we normally do push in the center of the chest, and then if we have a way to do mouth-to-mouth or mouth-to-mask, we can do that. But at the very least, chest compressions here and activate 911. So with an infant, hey, you okay? Baby doesn't respond. Activate 911, get some help coming. You can check a pulse here, but we do a terrible job at checking a pulse. Do we feel a pulse? Is it our pulse? What's going on there? So better to look for chest rise and fall. Baby's not breathing. We're going to start chest compressions here. So 2 fingers on an infant is suffice just because their chest is really not that rigid. So at 110 a minute, there we go. And that's it. If you want to give some rescue breaths, we can do 30 to 2 since I'm by myself. But the most important thing is hands on the chest. With the adults, same thing. Hey, you okay? Doesn't respond. Looking for chest rise and fall. Patient's not breathing. Now this is where we're going to start with 2 hands here. So 2 hands in the middle of the chest and same thing. Boom, boom, boom. If it's a teenager or smaller child, then you could do it one-handed if you're afraid you're going to hurt them. But there again, 2 hands here. Boop. So when I first learned CPR a little while ago, God, 25 years ago, probably, somewhere around that. Whew, man, I'm getting old. They didn't really explain to us very well why the chest compressions work and why we're doing it. So you're doing chest compressions, you're causing a pressure change, positive, negative pressure that's drawing air in and out of the lungs, one, and also it's causing a pressure change inside the chest area, thoracic cavity, and that's causing blood to draw into and out of the heart, coronary arteries as well. So we're doing that, it's a pressure change. So even though this guy's probably not doing the best CPR, he's down on his stomach, he's a little bit low, this child's so small, he's still doing good enough CPR that he is causing that pressure change, and he is keeping the blood flow going around the heart, which is what we need. So even though it's bad CPR, it's still good CPR. I would encourage you to sign up for a CPR class. You can watch videos all day long, but nothing beats actual hands-on experience here. So American Heart Association, Red Cross, all those are great organizations that will help you learn how to do CPR. So I'd encourage you to go find a class near you and sign up. Only takes a couple hours and you can get it knocked out, and you absolutely may save a life. So you never know when you'll be the first responder. Remember, you need the right gear and the right training.